the president is saying that he's going to have a great plan. You were at HHS. That's where a plan would have had a significant home and generation. Why 3 years in should Trump supporters and other voters who are thinking about voting for him have trust that he's going to come up with a plan when he's had all this time to come up with a plan and hasn't?
Well, I think the contrast to where we find ourselves right now is that there are real challenges in the healthcare system. And the question is, what is the answer? How do we get ourselves to a better place in terms of our healthcare system? And what the administration, I think, has been working on, and I know individuals, my old friends, former colleagues in the U.S. House and in the U.S. Senate, they've been working on issues to make certain that we don't put the government in charge of things, because we know that when that happens, then people are further removed from being able to communicate with their doctor and being able to get the treatment.
Fine, but that doesn't mean you don't have a plan. Why doesn't he have a plan 3.5 years in?
You'd have to ask folks that are there right now. If I had the privilege of sticking around for a period of time, I believe we would have been able to move a plan forward.
They should have a plan, right? Should they have a plan?
I had a plan. As you and I have talked about before, I had a plan when I was in the United States
Right,
House
but he didn't make that plan your plan, and he hasn't come up with any other plan except to say he's going to have a plan. That's not enough, is it?
No, you got to have a plan. You can't beat something with nothing.
That's right.
And so I encourage my colleagues to talk about the imperative of greater choices. We've been working on a plan through Job Creators Network and Physicians for Reform. It's called Healthcare for You, to make certain that we contrast it with Medicare for All. Medicare for All is a one-size-fits-all program.
I got you.
But what we want is Healthcare for You for individual patients all across this land.
I get it. Well, this is what we need to do. When the president puts out his competing plan, then we'll have two plans to compare. I want you to come back on the show and help me go through both of what you see as the pluses and minuses. Doctor, I appreciate you, Dr. Price, coming on. I appreciate you as a clinician. That's why I'm chasing you about the accountability, because we need to start telling people the truth and what to believe and what not, because we're getting sick, literally.